Hi, everybody, and welcome back to the Hypertrophic Cardiomyopathy Association's Facebook page. It is December 4th, and it is now 5:15. This is our second go live today. And today, this afternoon, that is, we are joined by Dr. Matt Martinez of Morristown Medical Center and the Chanin Mast HCM program, which is one of our HCMA recognized centers of excellence, but he is new to staff at Morristown. So I wanted to welcome Matt to both New Jersey and to the broadcast. Hi, Matt.
Hi, Lisa. Thanks for having me.
Great to have you here. So I'm going to tell everybody that this name may not be so new to them. Dr. Matt Martinez is not new to HCM at all. In fact, not new to the HCMA Center of Excellence programs, but he's moved to a new program. And now he is in Morristown. So I'm going to have Dr. Martinez, why don't you tell everybody a little bit about your background, where you came from, and what are you doing now?
Well, I'm excited to be here and excited to expand the services at Morristown Medical Center. I trained at the Mayo Clinic and was on staff there for both imaging in MRI and echo and cardiac CT, and part of the hypertrophic cardiomyopathy program there and the sports cardiology program. I then left there. I was there for almost 12 years and then left and then joined Lehigh Valley in Pennsylvania, where I started the program there, as you know, yep. Where we built a successful program and saw a new opportunity for myself and moved after 10 years at Lehigh Valley to Morristown, where I've been seeing patients here part-time. Now this is sort of an opportunity for me to be full-time in New Jersey.
Well, Jersey's happy to have you.
Well, as you know, this has been a long time coming. Lisa and I talked about Morristown more than a decade ago, approaching 15 years ago, and now it has finally come to fruition. So I could not be any more excited to be here than I am.
Well, seeing as you open the history box, I will say that so for those who don't know and aren't in the local area, the HCMA office is about 10-15 minutes away from Morristown Medical Center. And my own care for everything other than cardiology was at Morristown for many, many years. Electrophysiology has always been at Morristown, or was, for a transplant. But it's also the hospital where my sister Lori passed away. She had cardiac arrest at home back in 1995, and she was brought to Morristown. And it was always a little dream of mine to have an HCM center here in New Jersey. But the institution wasn't quite ready for the concept. It takes a little bit more than just community-based cardiology to run a good HCM program. And about 12, 14 years ago, they thought that they might be ready, and they were going to hire Matt. And I said, Matt, I don't think it's going to work yet. And he's like, you sure? I'm like, I'm not so sure. And they weren't really ready to start. And Matt ended up out in Lehigh Valley. So I kept them close, but not quite in New Jersey. And now the world has changed. And why don't you tell us a little bit, Matt, about what the Chanin Mast HCM program is and who are all the players? Because you got some good players.
We have some big players. So Morristown Medical Center has certainly come of age. If you look at the last 5 years from a cardiovascular standpoint, it is now ranked amongst the best in the country. We're routinely ranked in U.S. News in the top 25, top 50, and as well as in the world. As you know, Newsweek ranked us high on that list as well. So the Hypertrophic Cardiomyopathy Center fits in a place like this, and already a cardiovascular center of excellence. And now we're growing on what Dr. Marty Maron, Ethan Rowin, and even a little bit of Barry Maron over the last few years has grown. And the program has really the needs are greater than the services that we had, so we were able to expand it. So I could not be excited to be now linked more closely with Marty Maron and Barry Maron, both of whom I consider amongst my friends. I know them both more than a decade, and have worked with them on other projects, including the current HCM guidelines, which are not quite ready for prime time, but hopefully within a year. And all of that group has been here building the program, and now I have an opportunity to join that group of both Marty Maron, Ethan Rowin, and then, of course, our superstar nurse practitioner, Deatrah Debose, who is really the glue for the program and has really held this together and been boots on the ground. So I'm excited to now join her as boots on the ground for full-time services at Morristown Medical Center.
I could not be happier. I think having the program starting up was about 2014-ish. It was a part-time endeavor because Marty and Ethan would come down a couple of days a month. In fact, Marty's here right now. And
there she is.
Yes. Hi.
and I'm back. Sorry about that, guys. I disappeared for a moment. So Deatrah, we were just talking about the glue that keeps the HCM program at Morristown together, and that would be you. And you're live on camera right now with the Facebook community.
I'm having difficulty. Here we go. Now I figured it out. Can you hear me?
We can see you.
And we can see you. You're live. We were just talking about how the program is functioning and how cohesive it is now because you've been there the whole time, and you've got Dr. Maron's and you've got Ethan Rowin, and now you have Matt Martinez. And I'm trying to explain to the viewers what the system looks like now. When somebody calls in to get an appointment, what's the lead time? Who are they seeing? And how do things get structured going forward?
Lead time is very fast. We see patients within 14 days from the first phone call.
Okay, you're a little quiet. Can you rearrange your audio a little bit?
Okay. Can you hear me now?
That's a little bit better, yeah. So I'm sorry, what was the lead time?
Within 14 days.
14 days. That's amazing. We were getting out to a few months there. It was getting tough.
Yeah, it was getting pretty bad, yeah. But
So,
we're much better with lead time at this point.
so we brought in Dr. Martinez, and now we have a much better turnaround time.
Correct.
And I know that right now, the way that the structure is the echo lab is right across the hall from you guys. EP's around the corner. So everything is pretty much right in one spot. But we have some moves coming up, but we can't really talk too much about that. You might have a different appearance in a couple of months, maybe 6 months. So I don't want everybody to get confused about that. Now, does somebody want to talk to the issue of what about I see Dr. Maron or I see Dr. Rowin? Are they still going to be there?
It's a great question.
I'll let Matt take that one.
So Dr. Rowin and Dr. Maron will absolutely still be available. If you are a primary patient of theirs and want to continue to do that, then you will be absolutely allowed to do that, both here and in Boston if you chose to. But the benefit is that if something happens in between their visits, right, and you have a question on the spot, you need to be seen for a clearance for maybe a surgery, or that you have a quick question about medicines or a side effect or something else that comes into your life, then I'm happy to step in, see you, make a decision, involve Dr. Rowin and Dr. Maron, make sure we're all on the same page, and then sort of keep that medical team cohesiveness as a team approach.
Fantastic. And you have some assistants in the office there as well. You have Christina at the front desk. And do you have a couple of other people around the office now?
So we do. We have some real superstars. So we have of course Dee we talked about. We have our full-time nurse, which is Christina de Jesus, and we have 2 full-time MAs. Janice and Johanna have been trained fully and seeing patients and really comfortable with how to take care of patients with hypertrophic cardiomyopathy. The questions, the testing, the genetics, all of the pieces to the puzzle, they are well versed.
And as of right now, as I understand it, you guys are right around the 1,000 patient mark. Is that about right?
Dee?
Yes, we are around about the 1,000 mark. We're almost on our way.
That's a big program for 5 years.
Yeah, on our way.
So you're going to get a lot busier, I'm sure, because more people are figuring out what HCM is and making those very important referrals to centers of excellence. Now, Dr. Martinez, we talked a little bit about research, and you've got some research trials that you guys are going to be involved with coming up. You want to talk a little bit about some of the things that are coming?
Yeah, so I won't elaborate too much, but again, we're a consultative service, right? So the idea is to provide service in collaboration with the patient's primary cardiologist. And part of that comes with the ability to offer unique research opportunities. So in particular, we are seeing, we're already starting to enroll patients in a study for medical therapy for obstructive hypertrophic cardiomyopathy as a potential option to treat patients with obstructive HCM. Really exciting. One of the very few centers that are able to do this, and one of the newest studies available. And this is just the beginning, right? If you look at the next year or two, we are ramping up our ability to enroll patients for novel research opportunities. Really exciting stuff.
Fantastic. Is there anything else we should know about the program from either of you?
Come on down. We'd be happy to see you.
Fantastic.
And we're going to be inpatient and outpatient, right? We didn't talk about some of the services. If you get admitted, right, and you need to be seen, if you've got a hypertrophic cardiomyopathy question, if a patient team wants to know if we're doing the right things, or if you have hypertrophic cardiomyopathy, or you want us to be involved in the care, we're going to be able to deliver both inpatient and outpatient, full service, really exciting stuff here in New Jersey.
And we've never really had that in New Jersey before. And oftentimes I'm speaking to somebody from another part of the country, and maybe I don't have the intimate knowledge of the community. This is my home. This is where my family will get their care for HCM. Obviously, I don't need you guys anymore in that capacity. We have Brandy now. We're good. So I already put you through your paces and got kicked out of the program. But now you're going to be there for my family, which is an amazing amount of reassurance for me to know that my family has coverage 24/7, 7 days a week. And we've got the inpatient, the outpatient, and that's really what's going to make their outcomes better and their quality of life more improved, because they don't have to get on a plane or a train and go up to Boston or wherever for an emergency.
Right.
And we can handle that. So this is awesome. And we have the electrophysiology department right around the corner. Steve Winters, who's been an active board member of the HCMA since our founding. I don't know if you guys knew that or not.
No, I didn't know that at all.
Steve's great.
Steve Winters was actually my sister's electrophysiologist. And when things went badly, and obviously no fault of anybody at Morristown, my sister was mismanaged outside of the program, but that's where she landed after her arrest. And I became friendly with Steve, and I had this idea we should start something, and he was there since the beginning.
Wow.
So, and he's right around the corner from you guys. So
that's awesome.
Yeah, he's a good guy. So we've got EP, we've got genetic testing available there. We've got non-invasive cardiology. We've got invasive cardiology for diagnostics. No alcohol ablation there. Not yet.
Not yet.
Right.
It's in the works, ultimately, down the road.
We'll get there. And surgery is going to Boston at this point, but an eye towards bringing surgery at some point to New Jersey. But we're not there yet. We need better volume.
No, and this is it's a team approach, right? This is a collaboration between Tufts Medical Center and us, and the goal isn't to necessarily duplicate services, but to provide added services. And the amazing connection we have with Tufts and the ability to streamline, get patients in quickly. We tease Dee all the time because she sort of has the bat phone. She has the ability to get directly into Tufts, something very few people are able to do.
Yeah, I've tried to do that a few times. It is a bit complicated. So proud of her for being able to navigate that system. So we will take some questions if anybody wants to pose them. We can't give individual consults on Facebook, obviously, but if anybody has a general question about HCM or a comment, we're happy to take them. We do have a comment coming in here now from Heidi. They're hoping here because it's Facebook and they're choosing to post. So thank you for this program that I always do. Thank you all. So you've got a fan there, and
Thank you, Heidi.
so yeah, Heidi was one that took the trip to Boston and now has her zipper.
Awesome.
She's doing really well. So I think we're pretty much done spreading the big word that Matt Martinez is now Morristown Medical Center's Matt Martinez HCM specialist. I will take the opportunity. I won't do this to Matt, but I will tell people who have been a patient of Dr. Martinez previously. If you want to take the drive out to Jersey, it's not that far out, 78 from where you are. I do the drive often because I have a dear friend that lives in Bethlehem. So it's not that bad of a drive. If you want to come out here and you're coming out for your appointment and you want to stop by the HCMA office, we are literally 10 minutes away with lovely restaurants right downtown. So you can come see him and then come see me. That would be fun. I would love to do that. So if you're coming out this way, don't hesitate to give us a call here in the office. Looks like you guys are getting off a little easy tonight. We don't have lots of questions. We have 2 HCM experts sitting here waiting to take questions, and nobody's taking you up on it. You guys are lucking out tonight. That's good. Well, good for them, bad for you guys because you're not asking the questions. Oh, here comes a question. Here comes a question. We know who this one is. We are grateful to Dr. Martinez and Dee and the entire team over there. Looking forward to her husband's surgery in just a few days. So you know what that story is. So good to see you again, Teresa. And
Great family. Great family.
Yes. Awesome.
yeah, I kind of tripped upon them and pushed them your way because I meet HCM families in the strangest places. But that was a good find. So I think we're pretty good here. I'm actually going to go get in my car right now and drive down to Morristown because I have dinner with somebody there tonight. So thank you both for joining us this afternoon. I know it was kind of hurried to try to get it done on a clinic day. I thank you for doing that. Everybody can find Matt Martinez at Morristown Medical Center now, and Deatrah's there helping orchestrate all the care and as a fantastic nurse practitioner. You guys are in good hands here in New Jersey now. So I'm excited. Very excited. 14-day turnaround for an appointment now. That might be one of the nation's best turnaround times right now. So hopefully you guys can keep that up.
Awesome.
All right.
Thanks, Lisa. Good night, everybody.
Good night,
Take
everybody.
care. Bye-bye.